Welcome. What is a medical ventilator? How it works? A ventilator is a machine designed to provide mechanical ventilation by moving breathable air into and out of the lungs. To deliver breaths to a patient who is physically unable to breathe or breathing insufficiently. While modern ventilators are computerized microprocessor-controlled machines, patients can also be ventilated with a simple hand-operated bag valve mask. Ventilators are chiefly used in intensive care medicine, home care, and emergency medicine and in anesthesiology. A ventilator is connected to the patient through a tube placed into their mouth or nose and inserted into the windpipe. In some cases, patients have surgery to have a hole made in their neck, and a tracheostomy or trach tube is inserted through the hole to the trachea. The ventilator then blows gas into the patient's lungs. A ventilator can help a patient by doing all or some of their breathing, and it's superior to a mask and other devices because it can deliver higher levels of oxygen. It can also provide positive end expiratory pressure, which helps hold the lungs open so the air sacs do not collapse. If the patient has a weak cough, the tube in the windpipe also makes it easier to get rid of mucus. Ventilators are sometimes colloquially called respirators, a term stemming from commonly used devices in the 1950s. However, in modern hospital and medical terminology, these machines are never referred to as respirators. In the present-day medical field, the word respirator refers to a protective face mask. Intensive care environments around the world revolutionized in 1971 by the introduction of the first Servo 900 ventilator. It was a small, silent, and effective electronic ventilator, with the famous servo feedback system controlling what had been set and regulating delivery. For the first time, the machine could deliver the set volume in volume-controlled ventilation. In the 21st century, small portable ventilators, for example the Save 2, have been manufactured for forward combat use. Function. In its simplest form, a modern positive pressure ventilator consists of a compressible air reservoir or turbine, air, and oxygen supplies, a set of valves and tubes, and a disposable or reusable patient circuit. The air reservoir is pneumatically compressed several times a minute to deliver room air, or in most cases, an air/oxygen mixture to the patient. If a turbine is used, the turbine pushes air through the ventilator, with a flow valve adjusting pressure to meet patient-specific parameters. When overpressure is released, the patient will exhale passively due to the lungs' elasticity, the exhaled air being released usually through a one-way valve within the patient circuit called the patient manifold. Ventilators may also be equipped with monitoring and alarm systems for patient-related parameters and ventilator function, backup batteries, oxygen tanks, and remote control. The pneumatic system is nowadays often replaced by a computer-controlled turbopump. Modern ventilators are electronically controlled by a small embedded system to allow exact adaptation of pressure and flow characteristics to an individual patient's needs. Fine-tuned ventilator settings also serve to make ventilation more tolerable and comfortable for the patient. In Canada and the United States, respiratory therapists are responsible for tuning these settings, while biomedical technologists are responsible for the maintenance. In the United Kingdom and Europe, the management of the patient's interaction with the ventilator is done by critical care nurses. The patient circuit usually consists of a set of 3 durable, yet lightweight plastic tubes, separated by function. Determined by the type of ventilation needed, the patient end of the circuit may be either non-invasive or invasive. Non-invasive methods, such as continuous positive airway pressure and non-invasive ventilation, which are adequate for patients who require a ventilator only while sleeping and resting, mainly employ a nasal mask. Invasive methods require intubation, which for long-term ventilator dependence will normally be a tracheotomy cannula, as this is much more comfortable and practical for long-term care than is larynx or nasal intubation. Life-critical system. Because failure may result in death, mechanical ventilation systems are classified as life-critical systems, and precautions must be taken to ensure that they are highly reliable, including their power supply. Mechanical ventilators are therefore carefully designed so that no single point of failure can endanger the patient. They may have manual backup mechanisms to enable hand-driven respiration in the absence of power. They may also have safety valves, which open to atmosphere in the absence of power to act as an anti-suffocation valve for spontaneous breathing of the patient. Some systems are also equipped with compressed gas tanks, air compressors, or backup batteries to provide ventilation in case of power failure or defective gas supplies, and methods to operate or call for help if their mechanisms or software fail. COVID-19. A ventilator can provide enough support and buy enough time for the medical team to help the patient overcome the infection of lungs. In certain patients with COVID-19, the virus infection causes pneumonia and severe inflammation that cripples the lungs. Function. In these patients, having a ventilator available to support the patient can make the difference between life and certain death. Without a ventilator, patients with COVID-19 whose lungs are failing will suffocate and die. Thank you for watching this video. Goodbye.